HIPAA is the Health Insurance Portability and Accountability Act that regulates the creation and handling of personal healthcare information. What you are probably most interested in finding out about is whether it affects you. Well, this is a U.S. law, so it only affects companies that have to work under U.S. legislations. But even if you are not U.S.-based, keep in mind that there is a tendency for affected U.S. companies to include large parts of the HIPAA security clause in contracts they sign with other companies, regardless of their location. Secondly, HIPAA is all about personal health information relating to health insurance. But this does not narrow things down much because most people in the U.S. have health insurance, and companies offering health plans have to comply with aspects of HIPAA in terms of the health insurance information they hold and transfer to other agencies. As you can see from this table, which we have lifted from the official HIPAA website, the list of entities covered by this act is substantial, and company health plans significantly widen its reach. The bottom line is that if you create or handle personal healthcare information, that is data that can be tracked back to an individual, then you are almost certainly covered by the Act. HIPAA covers two key areas, security and privacy. If you fall under its influence, then you need to know both. But let's concentrate on the security rule, as that's the one that impacts your IT security policies. The Act doesn't call for 100% protection of data. It couldn't really, as there is no such thing. It does, however, include enough suitably vague statements like necessary safeguards that consultancies have sprung up all over the U.S., making good business out of helping companies prove that they are applying best efforts to meet HIPAA requirements. The security rule is only 8 pages long, but it gets very technical in places. It's broken down into 3 main areas: administrative, physical, technical. There also has to be a documented policy covering how the company plans to meet HIPAA requirements, including the checks and safeguards that will be implemented to ensure compliance. Your plan will need to cover various aspects. One of these is access, that is, the ability to read, write, modify, or communicate data and information, or otherwise use any system resource. Another is administrative safeguards. These are administrative actions, policies, and procedures to manage the selection, development, implementation, and maintenance of security measures. The goal here is to secure electronic protected health information and to manage the conduct of your workforce in relation to the protection of that information. Confidentiality is another aspect that your plan must cover so that protected data or information is not disclosed to unauthorized persons or processes. You must also implement physical safeguards, policies, and procedures to protect your electronic information systems and related buildings and equipment from natural and environmental hazards and from intrusion. Your plan should also include technical safeguards. This entails using the right technology, policies, and procedures to protect electronic health information and control access to it. This quick overview of the Act's IT requirements should be a useful first step to help you achieve HIPAA compliance.